Hello, brain core neurofeedback patients of Dr. Will Trebing's brain core neurofeedback offices in Mount Pleasant, South Carolina, and also Greenwich, Connecticut. This small film is to help you understand what each of your treatment screens mean. And we do keep every one of your treatment screen values in our doctor's portal and keep track of your progress. I encourage you to take a picture of the screen and also understand what each one of your visits means at the end of every visit, so that it's not just a bunch of numbers and squiggly lines on the page for you, okay? So right now I want to go over what all these different lines and numbers mean and how they're important. So on each one of your screens, you'll see the cursor I'm moving around here, all right? This side deals with how we are influencing the left hemisphere and during neurofeedback, and over here is the right hemisphere. And what brain waves we're working on balancing. Now, all these squiggly lines here represent different brainwave patterns, 5 brainwaves that we are actually monitoring. Now, if we go over to the scale over here, the different colors represent a different kind of wave. Now, for the right and left hemisphere, we see that we have 2, and they'll brighten up there as you go over them, 2 delta waves. They're usually on top. Okay, then we have 2 theta waves here and here. Then we have alpha, represented by the bluer ones. Then we have 2 different kinds of beta, the high beta and then the regular beta, which is here as well. So, that being said, we're going to close this up just so you know what they represent. Now, one of the goals of treatment that you will see as time moves on is called compression. Compression means when these lines are getting closer and closer together, then we're getting a balancing of the different brain waves that we are treating. So if these waves are far apart, that's what we're working towards bringing together. And in this particular session, you can see that that's what's starting to happen. Now, there are some people, after a good amount of care, where we do a neurofeedback session and all of these lines are just kind of going along straight down along the bottom. Right? That means that the goal of care has been accomplished as far as compression is concerned and balance has concerned. And that's what you want to see in this top screen. You want to see the lines coming together. Again, this is the delta, the green is the theta, the blue is the alpha, and then these 4 lines down here represent the beta activity. Now, of particular importance, whenever you see your screens, right, you're going to be looking at these numbers down below here, and I'll explain briefly what those are about. This side represents what we're treating on the left, and this side represents what we're treating on the right. And on the right-hand side, we have a beta value, which is for both hemispheres. And on the left-hand side, we have the alpha value, which is also for both hemispheres. In the center is a number called the training efficiency. And that averages out all the different numbers here to give you a efficiency notice as far as how well your session is going. Anything over 8 is really good. And sometimes we get above 10, 15, even 20 in the training efficiency. That means that what you're experiencing is balance. Okay, the balance of these waves is occurring because, again, remember that neurofeedback treats an imbalance in the way the neurons of your brain are firing. Okay, and that means the beta, the alpha, the theta, and the delta. If they're out of sync as far as the different types of neurons that fire in your brain are concerned, then neurofeedback helps bring balance to them so that they're all firing in a controlled and more functional pattern, so that one isn't firing more than the other, which causes an imbalance of brain neurons, which causes the different symptoms that you may have come in for. All right, so again, a neurofeedback is all about balancing these different waves. All right, when there is an imbalance, that is what neurofeedback treats. It tries to balance everything out. And that is a general statement because the computer program here has over 2,000 case histories, which it relates back to your particular brain map in order to produce a specific protocol just for you as to help to engage in that balancing. All right. So now when we look at each one of your screens, the two sides, this which says EMF down here and the EMF on this side, this just represents the two leads on the right and left side. And unless this is red, the EMF doesn't really matter too much. That just shows us your muscle activity. It shows us how relaxed you are. And it's how much you're moving, how much you're relaxed while you're on treatment. Anything that isn't red is good. So in this particular session, those values are good. We don't pay too much attention to those values in the EMG, rather, the EMG and not EMF. EMG is muscle activity on both sides. What we do pay particular importance and interest to are what's called the activation and the alpha symmetry, and as well the activation on the other side and the beta symmetry. So as you come from visit to visit, what you will be noticing is that you have an activation value on both sides. Now, what does activation mean? You should have, ideally, a ratio of 3:1 slow waves to fast waves. Now, the slow waves are the delta and the theta, and in some cases, the alpha. The alpha goes in between really the slow and the fast, and then the beta waves are the fast waves. And ideally, you should have a ratio of 3:1 slow waves to fast waves. Now, as you're commencing treatment, anything between 1 and 3 is good. It means you're progressing. And this activation is 2.15, so again, that's good on the left side. And over here we have 2.05, so we're doing good with the activations. It's like I said, and this number, anything over 3, anything under 3 in activations, it indicates that you're having a good session and that balance is occurring. The other thing we look at is your alpha symmetry and your beta symmetry. This is how we're working on balancing particularly the alpha waves within your brain. And this is 1.03. Anything over 1 and really not over 1.3 is very good. Anything under 1, we're still working to bring that up to 1. All right. Ideally, it should be about 1, 1.1, 1.3 is fine. And we very rarely see anything over that. But once we've got to 1 on both sides, that means that balance has occurred and we'll probably move to another protocol. Now over here you see the beta waves that we're working on in this particular patient. Not completely balanced yet, and the computer, the neurofeedback system is still working on balancing this to 1. So again, we want to get these values to 1, the alpha symmetry and the beta symmetry, and the activations should be 3 or under, ideally between 1 and 3. Now, let's give you a brief review of what all these waves mean. Okay, and of course it's great to have this video here because you can always slow it down and try to take it in and then go on Google and check out the different things I'm talking about so you learn. Because the more you know about your neurofeedback sessions, the faster things are going to go for you. So, on the wall next to our neurofeedback machines, I always have for our staff what the different important values mean. And this is waves in cycles per second, or it's called hertz. Now, when you get down to the slow waves here, we're looking at delta and theta. Anytime delta is 0.1 to 3 hertz, and that's the slowest wave. And these are sleep waves, as I've mentioned to you when you first started. Theta waves are right above delta, but they're still sleep waves, and they measure at 3 to 8 hertz. Okay? Now, we get down to what's considered faster waves. Alpha can be, it's kind of in between slow and fast, but it's still considered a fast wave by research. And alpha is between 8 and 12 hertz. And I say there, that's when you're chilling and when you're relaxed. Now, there are many different types of beta. The machine records low beta and high beta, and the normal beta is in between there somewhere as we're treating. But one of the most important waves that we treat is SMR, and that's the low beta. That's actually one of the goals, is to have a concentrated kind of chill wave, which is what SMR means, and that's between 12 and 15. Regular beta is between 15 and 18 hertz, and high is really very high concentration wave. That's anything between 20 and 30 hertz, and that's very difficult to maintain without brain exhaustion. Gamma, which we don't really measure too much, is anything from 30 to 120 hertz. And these are considered the fast waves. Now again, your treatment is involved in balancing the slow and the fast waves. And we said that the activation, which is over here, okay, activation again, on both of your sides, should be under 3. And that's why I have an analysis of activation up here. It's the ratio of slow to fast waves. 3 to 1, good normal. 4 to 1, that's you're going to have symptoms, ADHD, memory loss, that type of thing. 5 to 1, slow waves to fast, you're going to have anxiety. All right. And we very rarely see that once we start treating. 2 to 1 is excellent. And getting down below 2 tends to be, right around when we know that we need to switch protocol. Okay? Of course, 1 to 1 means a balance of an even amount of waves. And in my experience, what we want is just a little bit more slow wave than we have fast wave. Anywhere between 1.5 and 2 is really good on that ratio. And that's what the computer does. It tells us, the machine tells us how things are balancing. So if you have any other questions, feel free to ask me either through the office iPad, through the texting service, or next time I see you. And it's really great to have you all on board with us. We're very excited about our brain core neurofeedback practice and the results that it produces for people. As I tell everybody, the proof is in the pudding, and it's all about how you feel after a number of sessions and what this work is really doing for you. So keep up communication with us and let us know how things are working and how it's changing your life.